You're listening to In Your Pants with Dr. Susie G, the physiotherapist for your privates, helping you get in the know down below.
Hey guys, it's Dr. Susie G here, and welcome to another In Your Pants podcast episode. I am so glad that you're here with us today, and thank you so much for listening. Thank you. So, on today's episode, we're going to be talking about yoga, but we're going to be tying in some of the science behind yoga because there's so much yummy research that shows yoga or other mind-body therapies actually impact our neurophysiology. It impacts our nervous system, our immune system, our cardiovascular system, our respiratory system. I can go on and on and on, but I'm going to let our guests do that, actually. Some of the topics that we'll be covering are polyvagal theory and what it is, how we can incorporate mind-body therapies like yoga to help with our overall well-being, and also how it influences our pain and how we experience pain in the world. So such a great show. Our guests really take such a very, I think, complex topic and narrows it down so well into bite-sized information that you can understand. And also, we're going to provide some practical tips that you can use in your everyday life to help integrate your world, really, and enhance your well-being. So without further ado, I'd like to formally introduce Marlisa Sullivan, who is our guest today. She is an assistant professor of yoga therapy and integrative health sciences at Maryland University of Integrative Health. She's a physical therapist and a yoga therapist. She's also a researcher and author, and we'll be talking about her paper that she did with her colleagues, and including Stephen Porges, who is the pioneer of polyvagal therapy, which we'll be getting into. And anyway, without further ado, I can't wait to bring Marlisa on the show. So I hope you enjoy this episode just as much as I did. Good morning, Marlisa. Thank you so much for being on the In Your Pants podcast show with me.
Thank you. I'm happy to be here. Thanks for inviting me.
This is exciting because this is a topic that's near and dear to my heart as a yoga teacher now, and I've been practicing yoga for the past decade. I'm so excited to see that there's literature, evidence, research being done to support yoga as a philosophy and also as a practice for well-being, and also how it relates to the nervous system and your immune system and all those fun things that we'll probably talk about. But before we get into the details, Marlisa, tell me how you got into this work as a physical therapist yourself and a yoga therapist. How did you come across doing this research?
Well, I've been a PT for like a little over 15 years. And even when I started like physical therapy school, I was doing a little bit of yoga, like practicing it at home. And then once I started practicing as a physical therapist, I did mostly like outpatient orthopedic, working with pain conditions. And I was really interested in like I had studied medical anthropology before that. So I'd always been interested in kind of like how our emotions and our beliefs about health and healing impact our well-being and our health and healing. So I wanted to find a way to approach like the psychological, the emotional, especially those components that were so apparent in people with chronic pain, like how I could do that as a physical therapist, not a psychotherapist. And so that led me into deepening my yoga practice and kind of seeking out yoga teachers and yoga trainings that focused on more the energetic, the psychological, the philosophical, so that I could really begin to see how I could do that within my like scope of practice and within my place in someone's healing process as a physical therapist. So I became involved in the field of yoga therapy. And like you said, exactly, it's like this idea that the practices are within a philosophical context. And when we practice them within that context, they can be so much more powerful. And so I sought out different yoga therapy trainings. I was on the standards committee that created the standards for yoga therapy for like the accreditation of schools and the certification of individuals. I just kept with my, private practice. And then eventually that led to, becoming a yoga therapist and teaching in yoga therapy programs and my position at Maryland University of Integrative Health.
Wow, what an amazing journey. That's great. And could you tell our listeners what the difference is between yoga therapy? Is there a difference between being a yoga therapist or a yoga teacher?
Yeah, it's and that's something that like both fields, yoga and yoga therapy, are continuously defining right now. But the difference is that a yoga therapist has 800 hours of training beyond their 200-hour yoga teacher training, and so they're really learning how to apply the philosophy and the practices for the individual, and they're learning about different kinds of medical conditions and the neurophysiology of the person, of the human being, but also the effect of the practices, so that they're integrating yoga philosophy practices and biomedicine to create an individualized plan. So there is like some overlap, but then there's yoga therapists just go into a really detailed training to really be able to individualize to different patient populations.
Oh, that's so wonderful. It's probably on my bucket list next. I just finished my 200-hour. That was the beginning.
Yeah.
So I'm super excited, and I'm so glad we're talking about this. So speaking of the physiology and the biomedical aspects of the benefits of doing yoga, and not just the asanas or the postures, right? It's the whole framework of which yoga is, I guess, built upon and practiced. So could we probably go into that a little bit? Like, how you mentioned in your paper, and I'll state this paper. It's Marlisa was part of this paper called Yoga Therapy and Polyvagal Theory, the convergence of traditional wisdom and contemporary neuroscience for self-regulation and resilience. I mean, that topic alone, everyone, like, amazing. And this was a study conducted with Stephen Porges, who is the pioneer in polyvagal theory. And Marlisa, I'm going to have you take it away. Let's kind of start there. What is polyvagal theory and why is it important?
Yeah. So, and just, interrupt me whenever, or ask me any questions as I talk. One of the importances of understanding polyvagal theory is the idea that the autonomic nervous system connects all the systems of our body. So like from our autonomic nervous system, our digestion is affected, our cardiovascular system, our musculoskeletal system, like the amount of tension we're holding in our muscles. So our inflammatory immune processes. So it really connects all of the systems of the body, but it also connects that with our emotions and our thoughts and our mind, so that it's this link between our mental processes and our physiological processes. And together that then connects our behavior. So for example, when we're in that fight or flight response, we're going to have the mobilization of our systems in order to act in a way that ensures our survival. So our physiological systems are activated. Our emotions are going to be more like anger or fear or worry, and our behaviors are going to be such that we can mobilize and act out those emotions and activations. So the autonomic nervous system is this link between our behavior, our emotions, and our physiology. And there's a good body of research talking about how when we learn to regulate our nervous system, like to come into that parasympathetic response, that we have a decrease in the stress response, decrease in allostatic load, and it creates greater health and greater well-being in many diagnoses. So it's kind of a link between chronic conditions and helping to decrease inflammation, support the immune system, support the digestive system, and create positive psychological experiences. So then polyvagal theory comes and really deepens that idea and says that we have these underlying neural platforms from which we affect our body systems, our mental processes, emotions, and behavior. And instead of just saying like the sympathetic and the parasympathetic, it's really looking at like they're not dichotomous or antagonistic. And there's really this interplay between them. And one of the things that Stephen Porges found is that the vagus nerve actually has two origination sites that help to create two different parasympathetic responses. So we have like what we consider this optimal parasympathetic response, which he calls the social engagement system. And so it's a result of a part of the vagus nerve being activated, but also some other nerves. So like this whole neural network that allows us to have calm, optimal relaxation response in our body. And then we're more likely to experience things like compassion and empathy. It connects to our facial expression so that we can have more calm, connected facial expressions. It changes the contraction of our throat muscles, so we have greater vocal prosody, and it attunes our hearing to human sound out of white noise. So when that whole neural network is engaged, like when we perceive safety in our environment, that neural network engages, so we both can like connect to other people and then portray safety to other people. And then we have like the sympathetic, which is what we think of as a sympathetic, the fight or flight, that activation that I just spoke of. But there's also this interplay. So when we are doing a sport or dance, or when we're in some creative endeavor like painting, we have some of that optimal safety parasympathetic response, but we also have a little bit of mobilization of our system. So we can have them interacting to create safety and mobilization at the same time.
Well, and that's, sorry, I don't mean to interrupt you, but, and that's is very similar with sexual function.
Okay.
Right? Like, so having that, you have to be in that rest and relaxation phase to feel safe to have sex or be aroused, right? It has to be relevant. If that's not happening or your environment isn't safe, well, then there's no energy for that right now.
Yeah.
And then even, going to, for men in particular, ejaculation, that it's almost as it was said, and I actually, there's a paper that not too long ago came out that said the genitals or the erectile tissue are actually all driven by sympathetic processes, which is before we were thinking it was parasympathetic and sympathetic. But there was a paper that came out that said that actually it's all sympathetically driven. And the inhibition of that process based on what you're talking about might be playing a role. But anyway, I thought I'd chime in about that because sexual function actually works on these same processes that you're talking about.
And then one of one of the other neural networks that Stephen talks about, he actually links to like intimacy and sexual function as well, which is safe immobilization, where like there's this other. So it'd be interesting to see if that combination of safe mobilization and safe immobilization, that we can have that experience of safety, but the other part of the vagus nerve is responsible for slowing down our systems to the least amount necessary for survival. So like in its imbalanced form, which is called defensive immobilization, it's like the death feigning. So when a cat catches a mouse, the mouse will like lower, it won't consciously do it, but the mouse lowers its body temperature, heart rate, breath rate, so much so that the cat thinks it's dead, and the cat lets it go, and then the mouse can run off. So that's an extreme life threat. But then there's this ability to, where he talks about possibly in intimacy and even orgasm, that there is that immobilization, but in safety.
Right. And the key word here being safety, right? Yeah. Being safe to be vulnerable, to be heard, to be trusted. It's not in a vacuum, needless to say.
Yeah. And, yoga, from a yoga standpoint, like I was talking to Deb Dana, who also, she's worked with him a lot, and she has a book on clinical applications of polyvagal theory. And we were talking, and she was saying that like in meditative states, we often come into those experiences of immobilization, but safety at the same time. And there's that similarity with that.
Oh my gosh, that's awesome. Oh, and I just pulled up that paper. It's called The Sacral Autonomic Outflow is Sympathetic, and that is by Espinosa Medina and colleagues. So if you're ever interested, it kind of goes into the science behind that. But
I would love to read that.
Anyway. For any listeners who are wanting to geek out on some science. Awesome. Okay, great. Well, so moving on to, so that's all yummy. Let's kind of combine it with, well, how does, and you alluded to this a little bit already, but how does yoga therapy intersect with the polyvagal theory, and why is that important?
Yeah, so one of the things that that yoga teaches is that everything that is material nature are the things that change. So anything that begins, is born, changes, fluctuates, and then falls away and decays or diminishes is what's called material nature, or prakriti. And then, so we have our prakriti, which is our physical body, our thoughts, our emotions, the whole environment outside of us, everything that changes. And then we have our essential nature, which we could call purusha, which is this part of us that is unchanging, this non-changing essence of who we are. and that all of Prakriti, material nature, is made up of what are called the gunas, or these qualities. And the qualities are that of lucidity or clarity or luminosity, which is called sattva. That of activation, anything from creativity to anger and agitation, which is rajas. And then the quality of stillness, or tamas, which is anything from stillness to like obscuration, dullness. So within that, it's really like a very, and so one of the similarities is that instead of looking at, so one of the things that Polyvagal gives us is that instead of having to look at like what's happening behaviorally, what's happening emotionally, what's happening physiologically, like we can focus on the autonomic platform. And in the same way in yoga, instead of looking at like what's like, you know, all these different things that are happening in the body or the mind or the world, what's happening underneath. So the same idea that all substrates, every physiological aspect of myself, every mental process of myself, every way I relate to the outer world is some balance of sattva or clarity, rajas or activation, or tamas of stillness. And so it's reflective of these same three neural platforms. So we could say that when that like social engagement safety neural platform is activated, there's more access to sattva, there's more access to lucidity, luminosity. Or we could say it the other way. When we increase sattva, when we increase those experiences of peace, equanimity, clarity, luminosity, we're more likely to activate that social engagement neural platform. So that yoga has a very similar idea that underneath all of these like surface experiences of our body, our mind, and the world, there's these underlying substrates that we can begin to affect and change in order to regulate, in order to create resilience, in order to create greater well-being.
That's wonderful. So it sounds like this interconnectedness of just how we function in the world, both from an internal and external experience, kind of combining into one, that there is no essential, I guess, dichotomy, as you're saying, between the two. It's how do you create that inner experience that will definitely shape that outer experience.
Yeah.
And you mentioned change, that these processes have the ability to adapt and change. And if we practice in this way and create those patterns, the neurological, I guess, processes, strengthen them, as one might say, then your outlook and the way you live in the world might become very different. And I think it's worth noting too, maybe Marlisa, you can speak to this, that it doesn't just happen overnight.
Yeah. Yeah, it takes a while. Yeah. And one of the things I do find, like, I will often teach people the language of the gunas, because it's like we have less judgment around it. So instead of saying I'm sympathetically activated, or I have fight or flight, or I have anxiety, like being able to say, oh, this is like rajas arising, it's the quality of agitation, then it takes a little bit of the judgment away from feeling anxious or worried or tired or lethargic.
Yeah, it's like identifying, right? What is it that we're identifying with on a moment-to-moment basis? And is that identification serving you, right? So I'm an anxious person is much different. Saying that is much different than saying, well, I just have feelings of anxiety that arise. Because if you really analyze your world and how you act and behave, you know that you're not constantly like that. These are changing processes, again, based on a culmination of factors of triggers and why those feelings arise in that moment. And they've been practiced, so that's really easy for those things to arise. But it's not the true, as you're saying, this true essence, the Purusha.
Yeah.
Purusha, yeah, the true essence of your being or well-being, or whatever you resonate with in terms of that inner self.
Yeah, and then you can begin to look into like the gifts of anxiety. So like, anxiety is there for a reason. It's helped you. It's benefited you. And so what are the ways that you can make friends with that experience and appreciate that aspect of yourself that has protected you?
Yes, and that's what I say with pain.
Yeah.
Pain is a protector. It is not out to get you. It is a human experience that we all get to be friends with. And unfortunately, sometimes that experience may last longer or be more dominant for some people, and but it's not permanent. And I think just hearing you say these processes are changeable and we can work with them, and what is it that we can learn from this experience? Why is this pain here? Why is this anxiety here? Which usually come hand in hand, because pain is a stressor and increases anxiety and all those emotions and feelings that come with it. But yeah, I always look at it's a message, and what can you learn from this experience? And if we look at it from a different perspective, the things that we start to look at begin to change, and then it doesn't take such a sticky Velcro grip, heavy grip on your life and your quality of life, because there are many people who experience discomfort, and we all do to some degree. We are constantly in the state of balancing discomfort with ease and effort and ease, and it's always going to be there. It's just, how do we respond? What do we do with it when it comes our way, right? How do we want to respond? And what have we been doing? Is it serving you? Is that the kind of life that you see yourself living? So there are many people who live with that discomfort on a daily basis, but still have a very meaningful life.
Yeah. And yoga teaches us the methodology really to be able to discriminate, the neural platforms or the gunas, whichever language you want to use, from, like you said, that essence of who we are. And we were talking about this idea of well-being, and there was research around being connected to well-being, especially in terms of meaning and purpose, and meaningful social relationships, is really powerful. The effects on our inflammation, our immune system, the effects, like you said, on pain and pain interference. So the idea of utilizing this ability to be aware of the neural platforms changing. We're constantly going to be activated sometimes and unactivated sometimes. We're constantly going to have experiences of extreme lethargy or extreme activation. And when we begin to really, like you said, disidentify them and really just allow them and to notice that they come and go, we can experience that equanimity, and that equanimity has real effect for our inflammatory processes. And so if anyone, I don't know, I can always find this for you, but Stephen Cole has a lot of really amazing research, and he even has a video cast on the NIH about the effects of that well-being on genes and things like that.
That's amazing. And so could you define just briefly what you mean by equanimity? Because just in case, I know exactly what you're saying, but how would you define from a polyvagal theory and from a yogic philosophy, what is the state of equanimity?
So if I'm going to use the word equanimity for a second, I would say that it is that ability to maintain an equilibrium, maintain a balance, maintain a steadfast contentment amidst whatever is arising. And so, I do really like the term from Aristotle of eudaimonic well-being or eudaimonic happiness, which is about this idea of experiencing a level of fulfillment and meaning and purpose, steadfast contentment. And in the research on eudaimonic well-being, they differentiate that from hedonic, which is the transitory emotional experience of happiness, which is also really beneficial, but it's just different. It's just, we can, so equanimity is more that steadfast, non-changing connection to peace or balance.
Yes. And I think, just to add to that a little bit, if I may, it's more of this is an internal experience, correct?
Yeah.
Yeah, this is coming from the side of you, not from the external world or situation or circumstances that may arise. It is finding that peace from within, the contentment, as you said, no matter what adversity may arise in that moment. That in itself can kind of trickle into resilience.
Yeah, and if you can imagine from a polyvagal standpoint, when someone is in a sympathetic state, they're not able to easily access that. So the idea that instead of trying to have people do meditations about feeling equanimity, which feels fake and forced, and it often doesn't work. In the idea of what polyvagal theory offers is, let's shift their autonomic state. And as we shift their autonomic state, they're going to be able to be more in tune with that experience, and it can naturally emerge as part of it.
Right.
So that social engagement neural platform is important to help increase the accessibility to that.
Okay, great. That's a good question that came up for me right now. How can one start to shift that autonomic state?
So one of the things that the research talks about with yoga and other mind-body therapies is that it does something called top-down and bottom-up regulation. So top-down meaning we can use practices that start in the mind to affect physiological state, and we can bottom up, we can do practices that start in the body to affect mental, emotional states. So, and really like both are important. So we can take the portal that is more accessible to the person. So for example, someone that has a lot of chronic pain in the body, I find it very helpful to go outside the body for a moment and to really use those top-down practices. Like, what is an image, a memory, an image, usually like an image, a memory that has been, that brings them a sense of that well-being or happiness or contentment. And then can they bring that into their body? So I usually like kind of go out and then come back in. Whereas for other people, they might be experiencing a lot of agitation in their body, and so then using the body to create a different experience. So like, for example, we can use movement to create a parasympathetic state. And so that would be things like, for some people, it's not stillness, it's like slow rhythmic motion. And so slow rhythmic motion to take them from like agitation to gradually into calmer states of the body. Or like still restorative supportive positions. And even with someone in pain, when you give them an experience in the body through movement that is accessible to them, then they can like believe that it's there, they can find it again. We can also use breath techniques. So like using, the research has demonstrated that slowing the exhalation helps to activate the parasympathetic response, as well as alternate nostril breath or even left nostril breathing. So using different breathing practices to help cultivate a parasympathetic state. So we can use both like the bottom up through movement or breath, or the top down using visualization, imagery, or some kind of intention setting.
Oh my gosh, those are great ideas, everyone. I hope you wrote them down. Okay, awesome. Okay, great. And I think this goes into the last topic of how do physical therapists utilize these ideas and techniques. And I think you summarized it just beautifully. If there anything else that you'd like to add for maybe the practitioners working with people who are in pain or have chronic illnesses.
Yeah, I think, the idea of the top down and bottom up is like, usually there's one portal that is more accessible to the person, but it's really the combination that is most effective. So that, because you can have physiological restoration and still have a lot of mental angst and emotional angst, and vice versa. You can have mental, emotional calm, but a physiologically activated system. So when we, as physical therapists, are looking at people and doing our intake, our interview, our assessment, someone has chronic pain or they have a recurrent pain like that, it's always their back or it's always their shoulder. So beginning to help someone find ways to regulate their nervous system through movement and breath and mindful or meditation techniques, and then teaching them resilience is equally as important, which we kind of briefly talked about, and just because there was something else you said that I had wanted to go back, and that was what it was, is the life is naturally, as long as we're alive, we're going to experience the different neural platforms. We're going to have times where we're activated. We're going to have times that we're really lethargic. We're going to have tamas, rajas, all of those things. So the idea of resilience is that we can teach someone to regulate, but it's still symptom management, that they get activated, but they learn that they have that capacity to come back into calm psychological states and calm physiological states. So, which is really important. And I usually spend like a lot of time just developing that capacity. Mm-hmm. But then if we want to teach them how to like be in life, then we want to teach them how to, in that article, we talk about first traversing the neural platforms. So being able to do practices that are really relaxing and calming to the body and mind, and then something that's a little activating and then coming back down. So that activating posture or activating thing might be a posture that is physiologically activating, like bridge or balancing postures, or it could be something more emotionally activating, like even supported back bends, which can be, or supported forward folds. So being able to go back and forth. And then we can learn to what's called widen the window of tolerance. So we can teach the person how to stay in a relative calm state, even as they're physiologically activating. I saw that there was one term I learned called anxiety sensitivity, and it talked about using aerobic exercise as that, where like if someone's walking on a treadmill or running on a treadmill or a bike or whatever, their heart rate increases, breath rate increases, so it mimics anxiety. And and so were you going to say something?
Yeah. Oh my gosh, I was just going to say, I just had that like euphoric I just had that like epiphany of my own, like on my own self.
Cool.
Like,
yeah.
So everyone has anxiety, you know, comes and goes, but it particularly for me is, believe it or not, everyone, speaking in public, you know, doing a podcast. And I realized, I just out of the blue just realized, I was like, it is the same. My heart rate goes up in the same way when I exercise, but I do not get the same feelings or emotions associated. So if I can just feel my heart rate go, because that was what would really kind of increase that anxiety, is when my heart rate, I would feel like my heart was trying to jump out of my chest. And especially in conflicted moments, particularly if I have to express maybe you know, a conflict, I have to address conflict in some way, then it's like I have to speak my truth, but my heart would just like boom, 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 right?
Yeah.
And then I'm like, you know, it almost becomes this like maladaptive or negative state of being. But then I realize, like, wait a second, when I'm exercising, my heart does the same thing. And if I can relate to it in that way, that is a physiological response, how can I maintain my sense of calmness despite having this internal physiological experience?
Yeah.
Saying?
Yeah, exactly. And that's what like that whole idea of safe mobilization is about. Like we can learn to, and even that idea of like, oh, like, it's completely like the idea of normalization, where it's completely normal if you're going to go into a confrontive or like conflictive situation, that your heart rate is going to go up and that your mind is going to worry. Like that's actually like completely normal. So the more we can begin to say, oh, like, of course I'm feeling that way. And then we can begin to notice our heart rate and all those things. We can be in those activated states, but still experience relative calm, relative equanimity. And then we don't activate as deeply. So whereas before we might have gone from here to here, we then just go from here to here. Mm-hmm. So it's like widening that window of tolerance to be with stimuli. So if you think about like chronic pain, like fibromyalgia, where there's all this sensitization, and people will often report, patients will often report not being able to really handle any kind of stressors in life. So they can begin to, if they practice on the yoga mat or the physical therapy room, they learned how to experience the activation, but maintain relative calm, then that can translate out to life. And what I would say yoga does, it goes a little deeper to add another aspect of resilience, which is being able to see all and experience all of those stimuli as equanimity itself. So instead of just like maintaining equanimity within the stimuli, like actually seeing like that conflictive experience as part of like the totality of experience of who we are, and experiencing that as eudaimonic well-being, which is like, you know, enlightenment.
Yes. Oh, we're working on that.
That's like much later, but
yeah, that's much later. We're working on it. Baby steps, right? How to eat an elephant, one bite at a time. Okay.
Yeah.
Like, right. Yes. And oh my gosh. So so not all physical therapists are going to do yoga training, right? I mean, I think we can assume that. So what piece of advice, like, so for a physical therapist who isn't doing yoga or practicing yoga, could they still be just as effective if they use other strategies to help kind of bridge that autonomic, I guess, regulation, or still challenge the system, but then back off? Like, do you have any ideas?
Yeah, I mean, I think in a way we're always doing that, right? Like, because we will put people on the bike for 10 minutes to do something, or we'll do active postures like bridge, or and then we'll do relaxing things as well. So I think kind of orienting when you're seeing someone with a chronic or complex or persistent pain type of condition, like bringing your awareness to not only are they having these musculoskeletal issues and movement issues, they're having an autonomic system issue. And so how can I relax the nervous system? So some nice soft tissue work that relaxes the nervous system and the musculoskeletal system. Things like electrical stim. Like I remember going to a continuing ed training a while ago as a PT, and people were talking about how the meaninglessness of electrical stim. But if it's helping, create a parasympathetic response, you could say, oh, like I'm doing this to help really help the person experience a sense of safety, a sense of calm, relaxing the musculoskeletal system, relaxing the autonomic nervous system. So any of those like modalities that we use, or manual techniques that we use, or even beginning to use postures and movement that creates relaxation. So a lot of times we don't, as PTs, do postures for like to experience relaxation. So adding those into what we do. And then working with that idea of resilience is like maybe someone with complex chronic conditions, like only doing one posture that's activating for them, and then coming back to what's relaxing for them, and being able to just move back and forth and helping them build that resilience.
Right. And that's beautiful, because yes, when people are in pain, they're really afraid to move and do certain things. So it's part of like a graded exposure, graded activity,
Yeah, exactly.
right? You're knocking on the edge, you're nudging to, but not through, and you're challenging, you have to get some sort of arousal. And then teach the system that like, it's okay, like it's safety is right behind there. Let's go there, but then let's come back. Let's go there, let's come back. And then, like you're saying, that window of tolerance gets greater and greater and greater. That's beautiful. Oh my gosh.
And I think like just shifting our perspective of like, we're not just doing that for their mind, we're actually doing it for their autonomic nervous system, so that it's more than their feelings. It's like in their body, their autonomic nervous system is part of that dysregulation. And if we keep our lens on that, there's a way that we can approach it a little bit differently.
Mm-hmm. Right. What are your thoughts on apps like, or modalities like heart rate variability training? Heart math is one of them.
Yeah. I haven't done the heart math training, but I've heard really good things about it. And there are different like apps, like you said. So heart rate variability is the way people measure the vagal tone, and it can be a picture of that social engagement neural platform. So if you have an app like that and notice if there's a way of breathing that helps them access that state, which usually there is, and then a way of, and that's another thing us as PTs can do, is like work with diaphragmatic breathing techniques. And but those apps are nice because it gives someone an outer thing or stimulus to know when they're in that state, when they're not used to it within themselves.
Right. Oh, that's great. Well, thank you for answering that. Awesome. Okay. Well, Marlisa, can you tell our listeners where they can learn more about you? I mentioned your paper, but if there's any other resources or connections that you'd like to share.
So I work at Maryland University of Integrative Health. So we have our website, muih.edu. I also, I'm in the middle of doing a website that's marlisasullivan.com. We also have our new pain book. I thought I had it right here, but I don't. It's called Yoga and Science and Pain Care, Treating the Person in Pain. So we have that book. I am also on Facebook under my name. And right now, the website I use is Center for Integrative Yoga Studies, and I can send that to you.
Oh, that's wonderful. Thank you so much, Marlisa. This was so enlightening and enriching. I really appreciate you taking the time to not only speak to me, but all our listeners and share your wisdom. This is amazing. And I know it'll help so many. So thank you so much for that. And for all the contributors to the paper. I didn't mention you all, but thank you so much. And I really look forward to seeing what the future holds in terms of polyvagal theory, yoga science, and all that fun stuff.
Yeah. Thank you so much. I really appreciate getting to talk. And like you said, that paper's open access, so you can get it on the internet.
Even better. Thank you, Marlisa.
Thank you.
Thanks for listening to today's episode. Be sure to head on over to drsuzieg.com, where you can get more information, show notes, and related articles on today's topic. Also, if you like what you're hearing, head on over to iTunes, subscribe to the podcast, and leave us a rating and review. We'd love to hear your feedback. Thanks again.
I would feel like my heart was trying to jump out of my chest.